What else, Janet? What else would you like to add? Any guests? I know you're a big proponent of Dr. Scott Jensen. You're the one he was actually one of the first big guests that we found.
Yeah.
Tell our audience how we found that.
So I went to school in Fargo, North Dakota, NDSU, go Bison. And every once in a while, I pop in, and watch their news just to see what's going on in my family and the life of the people that live there. And Dr. Scott Jensen was on a local TV show discussing issues that he was facing as a physician on the death certificates of people that were dying during COVID. And then he also ended up on Laura Ingraham. And so I thought, you know what, Shawn, we need to interview this doctor and see what he has to say. And at the time, he was a local senator to Minnesota, which is important because it's right on the border and close to where my family lives. And at the time, I had my mother in Minnesota, and then I have classmates and friends that live in Minnesota. So our lives are, intertwined. And so it was someone who was very outspoken and actually educated and very passionate about his constituents and his patients. And he made a lot of sense. So I'm like, why shouldn't we reach out to someone like this and see what he has to say? And he was gracious enough to be on our show at least 2 or 3 times. I want to say
twice.
Yeah, and twice.
And basically, if you guys don't know about Scott Jensen, he doctor for 30 plus years maybe in Minnesota, family practice doctor. He was the first doctor or the first maybe person to kind of expose that hospitals were getting paid extra for coding positive COVID patients and getting extra for if they intubate them. He was the first one to expose that on Laura Ingraham. And I mean, when Janet asked me to reach out to this guy, I'm like, how crazy is that? This guy is not going to want to talk to us. And next thing you know, he's on our show talking about medical freedom. And if you guys follow me here, you guys know how much I believe in freedom, individual freedom overall. But on the show, we talk a lot about medical freedom. And he is actually, after the second show, when I interviewed him, we were interviewing him about the vaccine, the COVID vaccine. And after that show, for some reason, I was feeling like, because he didn't run for another term of senator that year. And so I just had to ask him at the end, I'm like, so when you running for governor of Minnesota? And he laughed and he didn't respond. And next thing you know, he's running for governor of Minnesota now. So there is a tight race in Minnesota. Minnesota is heavily blue. And I don't care whether it's blue, red, I don't care, Republican, Democrat. All I care about is individual liberty and medical freedom. And that's why, if I support Scott Jensen because he believes in medical freedom. And I just believe I believe in candidates that support freedom in general. So anyway, he's running for governor. It's a very tight race, which is close, which people are surprised about because Minnesota has not been blue or red in a long time. So just remember that when you vote next week, remember who supports your freedom and who is for individual freedom and for medical freedom. And that's one of the ways that we can change the system is to vote for people that believe in freedom. Speaking of freedom, Mary Bowden has been on our podcast, and she is a physician down in Houston. She was on our podcast but months before she was treating COVID patients. And she's an ENT doctor. And she's a cash only, non-insurance based practice because she realized the racket of an insurance based practice. So she stepped out and did a cash only practice. And then next thing you know, she's in the middle of treating COVID patients. And so that's what she's done over the last few years and treated thousands and thousands of patients and had a lot of targets and arrows on her back. But thank goodness we have doctors like her that stand up. So that's another very popular episode. We've had her on a couple times, actually at least 3 times now, I think. So Other guests, Janet, what are you thinking?
Well, that just brought me into Dr. Elizabeth Valite. She
Oh,
was
yeah.
probably one of the first that we talked to. That is she a member of the Freedom? I'm drawing a blank, but anyways, Dr. Valite is renowned for her work with fertility and working with women's health. And she has been very gracious. I think she was on our show twice, I believe.
Yes.
But huge credentials, and has been practicing and helping people make good choices all her life. So that was really encouraging. We met her personally, and then she was on our show. So she's one of my favorite guests.
Yeah, she's awesome. We're gonna have to meet her again. Or actually, I think we're headed to Arizona next year in January. We should see if we can meet up with her. Let's see. So another guest that comes to my mind is Dr. Shawn Baker. Very popular. It was on Joe Rogan in 2015, I think, maybe 16, about the carnivore diet. And it's a very, very interesting story. Not really a surprise if we follow the money in healthcare, but he was an orthopedic surgeon. I just found out, I don't know if this is true or not. I just found out that he let his license lapse because there were so many fights against him, and he realized that he could do better by educating people on the carnivore diet without doing surgery. So anyway, I think he's in New Mexico or Arizona. And he was an orthopedic surgeon, and he would tell his patients to start doing keto diet and then come back in 8 weeks. And, we'll see, how you feel and if you need surgery or how we're going to proceed with surgery pretty much. And next thing you know, a lot of the people would lose weight and they'd feel better and they wouldn't have inflammation and they wouldn't need surgery. So his surgery numbers went way down. And of course, then what happened is the system's not making a bunch of money. So his colleagues and or the local hospital system found some kind of bogus complaint against his license, and he had to fight that. And but here we fast forward 6 years later, and he's helped not only thousands, but probably millions of people on the carnivore diet. He went from promoting keto to promoting carnivore. And so for 6 years, he's done nothing but eat meat. And I mean, the guy's in great health, and he just talks how important diet is for our overall health. And of course, we talk about this a lot on the program. So Shawn Baker, look him up in our podcast, because it's a great episode. He talks about how 70% of orthopedic surgeries are unnecessary if people change their lifestyle. I mean, that's a powerful statement.
It is. So this brings me to one of my favorite stories too. And we've followed Dr. Story, who practices in Moscow, Idaho. And why Dr. Story is touching me in a way is that so many physicians and so many practitioners, nurse practitioners, PAs, nurses, pharmacists, physical therapists, I can go down the list, are so burnt out with our current system. He chose to step out and open his own practice. And has it been 5 years? I want to say it's been 5 years.
Has it already? Maybe.
But why it's so impactful is that when we've spoken to him and interviewed him, he decided that, I can step out and open my own practice and treat my patients in my community the way I feel is right and ethical. And the difference it made was, first of all, he could look in the mirror and he was happy, which meant that his wife and children flourished, and his practice is growing astronomically. And he's also looked at the surgical center of Oklahoma and planning to open a surgical center locally in his community that people can afford to access and actually have awesome care with a local physician. And the impact to me is that here we had this physician who's super smart, super good at what he does, who is so unhappy in his current situation and decided, hey, I can do something about it, stepped out and did it. And his story is so encouraging to me because it wasn't just about himself. It ended up being himself, his family, and his community. And God bless him. And I'm super excited to see where that will lead him and his community.
Yeah, amazing story. If you guys haven't watched that episode, we streamed that in August, I believe, from Dallas at the Free Market Medical Association. And yeah, he's got a thriving practice in little town of Moscow, Idaho. It's amazing. So another fan, Sam Madera, thank you so much for the kind words, and thank you for all you do. I've been following you lately on social media. You've been getting a little vocal again on social media, and I love it. So thank you for that. Thank you for standing up for patients' rights. So speaking of Surgery Center of Oklahoma, actually, Dr. Keith Smith is very instrumental in us helping start this whole movement and even keeping our cash pharmacy going. He's a pioneer in free market medicine. And one thing that he did is, I remember, Janet, over 20 years ago, when we stopped billing insurance at the pharmacy. I mean, we were taking hits from everywhere. People calling us crazy. People saying we wouldn't be in business, in 5 years. Employees didn't believe we could do it. Patients, family members and friends didn't believe we could do it. Well, how are we going to do this? And now 20 years later, we're thriving better than ever. But I remember one time we were watching the news and we saw an interview with John Stossel. And John Stossel says, oh, well, stay tuned because I am going to have Dr. Keith Smith on my show, and he's going to be talking about his cash-only surgery center. And I'm like, Janet, check this out. We're not the only crazy ones. So I watched that probably 15 years ago. And I remember when I was working with Crystal, and thank you, Crystal, for all you do for us, our Chief Marketing Officer. When I was working with Crystal and trying to tell her some history of my book and how I came up with some of the ideas, I said, well, watch this video. Well, next thing you know, so she watched the video of Keith Smith on John Stossel. Next thing you know, she contacts me and says, hey, I got an interview set up with Dr. Smith. I'm like, what? And that was actually officially before we started this podcast. I think I interviewed Dr. Smith in 2018. And I was just, it would have been April. It would have been April 2019. I interviewed Dr. Smith because we were in Nashville at the Dave Ramsey conference. So I interviewed him, and I'm like, after I got off the phone, I was so excited because I'm like, wow, there is a guy that's crazier than me when it comes to conspiracies in healthcare. And we've interviewed him at least once since then. No, twice, actually.
Twice.
Times, yeah. And we've toured the Surgery Center of Oklahoma and loved it. Got to meet him, have lunch with him. For those of you that don't know about the Surgery Center of Oklahoma, if you are thinking about an elective surgery, it is worth the flight to Oklahoma. People fly from all over the world to get surgeries there because it is 1/8 to 1/10 the price of what you would get charged at your local hospital. It's incredible. Transparent pricing. His prices are posted on the website. So on his website, Surgery Center of Oklahoma. Yeah. So if you need a total knee, look it up. And if it says it's $18,500, that's what it is. All inclusive. No surprises. Transparent pricing.